Now it's my pleasure to introduce Jane Freudenberger from our program committee, who will introduce today's speakers. Thank you.
Thanks, Don. How's that? Can you hear me? Okay. Obviously, this is a very important topic in our community, judging by this sellout crowd, and we know we can count on all of you to have a civil and respectful conversation today about this topic. Catholic hospitals have had a long, respected tradition of health care in the United States, and at the present, they count for more than 12% of our health care institutions. But here in the secular, mostly secular, Northwest, with mergers and acquisitions on the rise, there's a possibility that more than half of the hospital beds in our hospitals may be under Catholic auspices. In many communities, ours for one, the only choice for acute care is a Catholic hospital. Because of the acquisition by that hospital of labs and physician practices, when these providers adhere to various ethical and religious directives, those providers may not offer the services that you want. Patient care is inevitably restricted. Our panelists today are going to discuss the history of this transition, the laws and directives behind the controversy, and the mission of our local hospital. We had a little contretemps this morning. One of our speakers, Cienna Madrid, had a terrible morning. Her car collapsed on her, and after many attempts with AAA and an automobile dealership, she finally gave up and she couldn't make it. We are very happy to have another speaker, Sarah Dunne, who has been scheduled to speak, who has her notes and who is going to fill in for her part of the program. We'll be giving Sarah some extra time, and our other panelists too. Sarah Dunne is the legal director for the ACLU of Washington State. She earned her law degree from the University of Chicago. She also earned an A there from her professor in constitutional law, Barack Obama. Sarah will give an overview of the ethical religious directives and compare them with existing Washington State laws. And she's also going to give a little bit of Cienna's presentation. So I want you to give her an extra special clap today when we get ready. Wait. Not yet. Nancy Steiger has a bachelor degree in nursing and a Master of Science from the University of California, San Francisco. She's the Chief Executive Officer of PeaceHealth St. Joseph Medical Center. Ms. Steiger is joined by PeaceHealth Senior Vice President for Legal Affairs, Stu Hennessy, at the podium, and together they're going to share their viewpoint on PeaceHealth and its mission to provide health care to many of our communities. We had intended to have 3 15-minute segments, but as I said, we're going to change a little bit, so Sarah will have a little longer. I'll be watching the time when I walk up to the podium. She's going to immediately stop, I'm sure. So please welcome all of our speakers, and Sarah in particular, at this moment.
Thank you, Jane, and thank you to the City Club for inviting us here today to speak on this timely and critical issue that's... Sorry, you can't hear me? Is it even loud? Is it on?
Let me check it.
I think it's on. I'm going to talk louder. How's that? Is that better? I'm going to hold it. That's even better. Okay. All right. I feel like I should be walking. It's like the jury. So thank you for having us up to talk about this timely and critical issue. And I am sort of giving an apology in advance. I'm pinch hitting a bit for Cienna, and I'm going to give an overview, which I prepared about 20 minutes ago. So I hope this will go fine. I'm going to start today with a story that's a true story that I think frames the issue that we're talking about today. There was a Washington couple who was driving across the country. And they were in Oklahoma when the wife all of a sudden felt some sudden pain down around her uterus. They went to the emergency room, and it turned out she was pregnant, but she had an ectopical pregnancy, which for the men in the room, that just means that the embryo was stuck in the fallopian tube and had not traveled down to the uterus, which is typically where the baby develops. That can be catastrophic for a woman and fatal. It turned out that she was at a Catholic hospital. The doctors came into the room and said, okay, here's what's happening. We're so sorry you have an ectopical pregnancy, and we're going to need to remove your fallopian tube. She wonderfully had a smartphone with her and started to Google what to do when you have an ectopical pregnancy, and discovered that there's a drug that can actually be administered, which essentially destroys the embryo in the fallopian tube, and there's no need to take out the fallopian tube. She then, unfortunately, because this particular hospital refuses to do that procedure because of it's a Catholic hospital and that's not allowed, she then had to get into her car, and her husband had to take her to another hospital nearby in order for her to get the drug. The happy news here is that her fallopian tube was saved, and they do want to have children. So why we're here today is to talk about access to medical care. And I think why this issue should matter to all of you, the ACLU takes the position that Washington residents in their community should have access to the medical care that they deserve and is available under the law. And we're concerned that patients are being put at risk. The ACLU doesn't believe that religious doctrine should be dictating medical care. And we have concerns that public dollars are being used to fund religious institutions. Now, at the outset, I do want to acknowledge Whatcom County residents are in a bit of an unusual situation. The rest of the state is now grappling with this issue. And Whatcom County, and people can correct me if I'm wrong, I want to say for almost a decade now, the residents have been living with healthcare with very limited choice. PeaceHealth, as I understand it, does own the hospitals, do own most of the physician groups except for one, I believe, Family Care Network, that's independent, and of course owns the labs. So I think as we're grappling with this issue, I think a spotlight will eventually be shined on Whatcom County. We do have in Skagit County right now, there's a potential transaction pending with 3 hospitals. PeaceHealth has put in a bid for that. Certainly if PeaceHealth wins that particular bid proposal, they then will own Whatcom County, Skagit County, and San Juan Island. And as I think we want to increase the discussions around these issues, we all want more efficient health care. We all want good delivery of medical services, but we want it at a low cost. And so I think part of what I'm going to talk about today is really the religious directives in medical care. And what's missing from my part of the conversation, and I want to acknowledge this, is the real potential effect on healthcare costs that this may have if you start to have situations where you have healthcare corporations that have mini monopolies. For Cienna, what she was going to talk about, how did we get here? Well, in 2010, we passed healthcare reform, the Affordable Care Act. And as I was saying, you know, everybody wants more efficient healthcare. We have rising healthcare costs that are going out of control and really harming everyone. And for example, one of the reforms that came out of the ACA Act was electronic records. Makes sense that hospitals and physicians should now use electronic medical records. Smaller rural hospitals don't necessarily have, unless they had the foresight, they don't necessarily have the IT infrastructure, for example, to deal with electronic records. So there's an opportunity for larger, well-resourced healthcare corporations to come in and offer those services to these smaller hospitals and eventually take them over. Now, why are we talking about religious healthcare corporations? What was really sort of not on my radar until the last year or so, religious healthcare corporations comprise some of the largest healthcare corporations in the country. 1 in 6 Americans will receive their medical services from a Catholic hospital. Healthcare corporations are financed by public tax dollars, Medicare, Medicaid, private insurance companies, and so that's where the funding is coming from. And it happens, Catholic healthcare corporations have been well run. So as we come into 2010, 2011, and 2012, you have a situation where there are opportunities to take over smaller rural hospitals, but the corporations that are doing this need assets. And it is the Catholic healthcare corporations that do have the assets. I want to say PeaceHealth has around 700 million, is that right, in assets? And then there's some other Catholic healthcare corporations that operate in Washington State. I'm thinking of one in particular. I want to say Providence has over $1 billion in assets. And this is what essentially allows them to be a welcome partner to the smaller hospitals. So in 2010 in Washington State, only about a quarter of the hospital beds in Washington State were operated by religious hospitals. Less than 2 years later, we have over 40% of hospital beds in Washington State are operated by religious hospitals. I put on your, normally I sometimes do a PowerPoint presentation. I've put on your table, you'll see two different handouts. Here's one, and then and I'm going to pass these down to Stu. And you'll notice one is the map of Washington State. In 2013 alone, we've had 9 transactions. There are 9 that are pending or completed. And by the end of the year, if all of those transactions end up where they're headed and do end up affiliating, partnering, merging, whichever word you want to use, with religious healthcare corporations, you'll have 10 counties that are essentially religious, which means that the residents within those counties will not have secular alternatives unless they travel outside of those counties. It's a very, I mean, I think it's a sobering moment, and people need to look. And I think what, and I guess I want to, before I talk about Washington State and our religion, I do want to pause and say, this issue is not just about hospitals. You're going to hear us talk a bit today about hospitals and transactions, but I think it really has been a mistake on our part to be so limited in our view. These are healthcare corporations that really the new vision for healthcare is a continuum of care. And I think it's probably not right to say one-stop shopping, but what it means is that you can go to your primary care doctor at your clinic, who then may refer you to a specialist at the hospital. You may have to go to the pharmacy to get medicine, and when you go to the primary care doctor or the specialist, you're going to have to get tests run. And the idea is that the healthcare corporation owns all of that. And so I want to be clear that it's not just about hospitals. The other issue to put on your radar is medical student training. The University of Washington Med School provides the medical student training for a 5-state area. Right now, of course, the medical students do 4-month rotations, and they are doing particularly the primary care. The University of Washington has one of the best primary care medical programs in the entire country. And these students rotate through various hospitals around the state, including religious hospitals. Really, my focus is more on the residents who do stay, and primarily their whole time is spent at the hospital. So for example, there are residency programs on the eastern side of the mountains with a Catholic hospital where right now the director of the residency program does do a rotation of his residents to the local Planned Parenthood in order for them to get the medical training that they need because it's not allowed at the particular hospital. So that's just something to put on our radar. You know, we can obviously talk about workarounds, and I guess the question that I want to raise is, how much do we want to be thinking about workarounds? And is that the best efficient use of healthcare and our resources? So back to Washington State. Why is there a disconnect? Why are we so upset that over 40% of our hospital beds are now being owned and operated by religious healthcare corporations? Washington State, however you feel about this, happens to be one of the least religious states in the country. 25% of people in Washington do not identify as religious. And certainly for the significant population that does identify as religious, most of them do not identify as Catholic. And so that is what is troubling to some folks. Now, why are we talking about Catholic healthcare corporations in Washington? The only reason I'm doing that is because that just happens to be who's operating in Washington. We have Providence Healthcare System. We have Catholic Health Initiatives, which is the parent company for Franciscan Health System. You'll hear mention of Franciscan Health System, and they're just simply a subsidiary of Catholic Health Initiatives, which is based in Denver. And then, of course, you have PeaceHealth based in Vancouver, and then Ascension as well. And so what's different about Catholic healthcare corporations? And here's what's different. And this is why I was asked by Jane to provide a little bit of information about this. Religious healthcare corporations, their medical care is dictated by religious doctrine. And what do I mean by this? There is a document called the Ethical and Religious Directives. It's in its 5th edition. It's on the internet. God love the internet. The most recent edition was published in 2009. I think it's really important that you actually take the time to go. It's very easy. Just Google or Bing it. I think it's really important to take the time to read through that document. That is what guides the religious healthcare corporations. And this is a document that was drafted by the bishops. This was not a document that was drafted by medical care providers. And I'm going to go through some of the directives. What I've put on the table, you'll see flashcards like this. You know, I don't have a PowerPoint here today, and I think really it's important to really actually, you can hear me speak all day, but I think it's actually really important to read the actual words of the document and what it is. So I've taken various directives from the document and put them on flashcards that you can pass around and read. Now, in terms of the Catholic healthcare corporations that operate in Washington, Providence and Franciscan are strict adherents to, I'm going to call them the ERDs. That's the Ethical and Religious Directives. What PeaceHealth has done is they acknowledge that the bishop in each diocese is allowed to interpret the ERDs how they want. And so what they have done is they have drafted their own ethical policies that are consistent with the ERDs. And then and those are what they operate with for their everyday medical care. And then they've also drafted a statement of common values, which again is available on the internet. It's available up on PeaceHealth's website. And that is consistent with the ERDs. They have taken variations of the ethical and religious directives on various medical procedures. And so I just encourage you to become informed and to read through this document. As I said, they cover multiple topics. So for example, fertility treatments. The ethical and religious directives, the Catholic Church does not believe in fertility treatments. So things such as in vitro fertilization and other artificial reproductive technology is not allowed. 1 in 7 couples in America face infertility. Now, PeaceHealth doesn't allow IVF or donor insemination. However, I believe that they do allow counseling on fertility, and then I'm sure that Mr. Hennessy and Ms. Steiger talk about, if people have more questions about the extent to which they offer counseling and information in their hospitals and medical clinics around fertility. Birth control, something we take for granted. The ethical and religious directives take a position that Catholic healthcare corporations may not condone or promote contraception. Now, for example, I'm going to, United General, which is a hospital in Cedar Woolley, which has entered into a partnership with PeaceHealth. There's a great there's an FAQ up on their website. Again, I encourage you to go and look and read. And what's interesting there is PeaceHealth, for example, they will provide information and counseling on birth control, and their doctors are allowed to prescribe birth control. And what's interesting there is they do state that the doctors are allowed to prescribe birth control so long as it is medically indicated. What that means is that there has to be something in their medical chart which says there's a reason or a justification for the birth control. Is it cramps? Is it endometriosis? So if I'm a woman just walking in and I want birth control, which by the way I'm allowed to get under the law, there doesn't have to be a medical justification. Unfortunately, in the Catholic hospitals that do allow birth control, it's got to be medically indicated. A couple years back, it was even more of a serious issue because that was essentially putting something in a woman's medical record that could be considered as a pre-existing condition, which might affect their ability to get health insurance in the future. Hopefully with healthcare reform, the notions of pre-existing condition are going away. But again, that would be a question for women who are of reproductive age going to PeaceHealth facilities to ask, am I getting my birth control just straight up, or are you marking something in my chart that says that it's medically indicated? In terms of sterilizations, vasectomies, women getting their tubes tied, those are not allowed by the ethical and religious directives. And again, you have a range in how the Catholic healthcare corporations interpret the ethical and religious directives. So for example, Franciscan does not allow vasectomies and tubal ligations. However, PeaceHealth, I believe, does, so long as, again, it's medically indicated. So if I am a male wanting to go to PeaceHealth to get a vasectomy, there's got to be a medical reason, not just, I want my vasectomy. In terms of abnormal pregnancies, which I started this presentation with that, they can be catastrophic for women. There's been a lot of news nationally on this issue. There's been some other incidents. There was unfortunately a nun in Arizona who was briefly in trouble with the Catholic Church because there was a woman who had an ectopical pregnancy, and they went in and performed an abortion. And you know what, as I'm pausing, because I think she didn't have an ectopical pregnancy, I think she just was, she was having problems with her pregnancy, and she ended up, the nun made the decision that they needed to go in and do an abortion. But getting back to ectopical pregnancies, that'll be a question that I'll leave them to answer, whether or not they do administer the drug, for example, that would save the woman's fallopian tube, or whether for PeaceHealth ethics, their ethical medical committee, whether or not they allow the drug to be used, or whether or not they do require the fallopian tube taken. The ethical and religious directives do not allow a medical doctor to take a direct action that would result in an abortion. And so that's why administering the drug during an ectopical pregnancy, that would be considered an abortion. But I'm sure, but PeaceHealth can address if they have a different medical standard for how they deal with those. The advanced directives are also covered in the ethical and religious directives. And again, you're going to want to read really carefully. I think it's a really important issue for all of us. And I think you can look on the different healthcare corporations' websites. In terms of the ethical and religious directives, and there's cards on your table which address these particular ones, they talk about certain palliative care, certain being allowed, so long as it's not contrary to Catholic teaching. So where I would leave you all is that you need to ask your medical provider. You need to be showing them ahead of time your advanced directives, and just hopefully getting the confirmation from them and talking through with your particular medical circumstance and confirming that in fact your advanced directives and the particular situation that you're dealing with will be honored. And then death with dignity. Many of you know that's where an individual is allowed to access, an adult is allowed to access a lethal dose of medication. Death with dignity is lawful in our state. It is not condoned by the Catholic Church. Catholic healthcare corporations are not allowed to participate in death with dignity, and that's just across the board. All of them do not participate in death with dignity. One of the more challenging aspects of the ethical and religious directives is the doctor-patient relationship. And you're going to hear some of the healthcare corporations say things like, we never interfere with the doctor-patient relationship. Conversations between the doctor and patient are private. They're sacred, in fact. And what's interesting about the ethical and religious directives, and it states specifically, this professional-patient relationship is never separated then from the Catholic identity of the healthcare institution. Also, as part of the ethical and religious directives, and this makes sense given that they want to impose this doctrine, the healthcare services, as a policy, the employees, the medical care providers and staff, as a condition of privileges and employment in the hospital and the healthcare facilities, have to abide by the ethical and religious directives. So, for example, Franciscan requires it as a condition of employment. And that would be a question you would have for your medical care provider for PeaceHealth. Are you required to comply with the ERDs? Can I just wrap up in a minute? Okay. So this is the question that you have for your various healthcare. How does this work, right? Let me give you an example. The United General website. PeaceHealth says we never interfere with the doctor-patient relationship. Death with dignity, for example. But they state very clearly they will not make a direct referral to a provider who provides prohibited services. So what then happens for the doctor and patient? So if I'm a doctor and I give a direct referral to Dr. North, for example, who does engage with death with dignity in Whatcom County, is that doctor going to be fired? If a doctor prescribes birth control but doesn't put on the medical record, the electronic medical record, which can be audited, doesn't put that there was a medical indication, is there any kind of repercussions that the doctor faces? That's something to be asking your providers.
We want to have time for questions, so
Yeah.
I'm going to cut you off.
I will just say thank you so much. I hope that, again, I do apologize that the issue of healthcare costs really wasn't a part of my dialogue, and I'm sorry I didn't get to address the law. Thank you.
I hope you'll get to address it in questions. Thank you, Sarah, and especially thank you for laying out the issue, too, and using some of your time for that. And we will give you, Nancy and Stu, a little bit extra time also. But we do want to leave time for questions because, as you can see, people are sitting here on their hands ready to raise them.
Well, we're on our hands as well, so thank you so much. And Sarah, thank you so much for laying out your perspective on this. My name is Nancy Steiger, and I feel honored and privileged to serve as the Chief Mission Officer and CEO of St. Joseph Medical Center. I'm a nurse by background, education and training, and before I came to PeaceHealth, I was the CEO of San Mateo Medical Center, which is a public hospital and clinic system. We did 200,000 visits and lots of inpatient things as well. And I felt compelled, I felt called to Bellingham, to St. Joseph Medical Center, in large part because of the mission, the values, and the vision of this organization. And it's not because I'm Catholic, I'm Jewish. But still, the mission and values of PeaceHealth inspired me so much to leave California after 30 years and to leave my children there so that I could serve as the leader of this incredibly fine organization. And listening to some of what you have heard, you might wonder how it is that we're top 5%, only 3 in this state, to receive top 5% healthcare quality and compliance. You would be surprised to know that our heart surgery program was ranked #1 in the state. You'd be surprised to know that our neurosurgery program was ranked #1 in the state, and our pulmonary program #1 in the state. And it's because of the quality and the incredible physicians that we have, as well as all of our caregivers, that we are able to achieve the accomplishments that we have to provide health care to you, the residents of Bellingham and Whatcom County. Our sisters, who were 18 and 20 years old when they came here over 130 years ago, they weren't nurses or doctors. They didn't have masters in health administration or MBAs. They simply came to listen to the community and to meet the needs of the health care of the people in this community. And Stu and I are here today to listen to you and hopefully better learn how we can meet the needs of the community that we so proudly serve. One of the things I want to emphasize is that in every community we're in, we have been invited. And I think that's probably a bad strategy, because if you want to grow, you probably are looking for where you would grow. But in every place that PeaceHealth serves, starting with Bellingham, we were invited by the smart people in the communities to better meet the needs of the healthcare communities. And most recently, we were invited to serve in San Juan Island, where they did not have a hospital. And we also provide services in Ketchikan, Alaska, where you have to make oxygen and barge garbage. We go to communities that are often in crisis or who have services that they could not sustain themselves. And so the smart leaders in communities seek partners, and when they seek PeaceHealth, they know who we are, they know our mission and values, and yet they still ask us to come to meet the needs of the loggers and the miners, as our nuns did over 130 years ago. In many of these cases, as I said, vital services are at risk of being lost, and in every case that we have been invited, we have never stopped providing any services. We have only added services, and San Juan is a really good example. Before we were there was an inter-island medical clinic that was, doing the best it could. It was not financially sustainable, and they really were having trouble meeting the needs of the community. Many patients had to either ferry off or airlift off for basic health care needs. They had to leave the island for basic mammography and other services like that. And others were invited to provide services in San Juan, but we were chosen with full knowledge of who we are as an organization and our values and mission statement as well. But they were at risk for losing critical services. I also want to reiterate, I want to make clear to you that the physicians on Inter-Island Medical Center neither performed abortions or euthanasia before we participated. We continue to not perform abortions and euthanasia, yet over 1,000 people have received emergency services, chemotherapy, endoscopy, and many other services that were not available on San Juan Island. So I feel like we've added a lot of value to San Juan Island, and nothing has been stopped or diminished since we've been there. And so I guess I would say that we have a track record of investing in communities. We've put over $20 million into the San Juan community, and we have reduced no services. As to the issue of tax dollars, Bellingham receives no tax dollars by directly. We do receive payment from the government through Medicaid and Medicare, but we are not subsidized in Bellingham with tax dollars. That's not true in San Juan, and it was part of our negotiation to continue to receive tax dollars. But as I said, even with the tax dollars, just primary care was failing. And so those tax dollars go completely to care for uncompensated care and to provide access to care where care is not available. And so here in Bellingham, $50 million goes to uncompensated care. And again, we do that with no tax support. Hospitals in Skagit County, United and Skagit Valley do receive tax dollars for the services that they provide. And I don't believe that United General or Skagit Valley provides either abortion or euthanasia. So I think I'll stop there, or unless I should address some of the specific reproductive issues now, or did you want to?
I'll go and we can kind of go
Okay.
back and forth.
Okay, so you go next.
So we weren't really coached on the format for today. So if we get it wrong, you just tell us. My name is Stu Hennessy, and I've been the attorney for PeaceHealth for 24 years. I've been doing this so long, I can remember when there were more doctors than attorneys in hospitals. You look up here today, you can see there's one healthcare and two attorneys. And that's kind of where we've gotten to in America, I'm sorry to say.
So what's wrong with healthcare?
So I kind of thought I was asked to come here to talk to you about the legal part, because the ACLU has had a letter where they've said, well, gosh, this business of in San Juan, where they're given tax dollars to help support a Catholic hospital, that violates the Constitution. And but Sarah didn't get to that. I think I will speak to it later on. But that's going to be a short conversation, because it's very clear in the Washington State Constitution that you can use public support for Catholic hospitals. In fact, I'll read you part of that Constitution, and you'll see that it specifically makes an exception so that money can be spent for health care by private companies. Okay? But, to tell you the truth, contrary to the billing that, the advertisement that brought you all here, I don't think this really is about Catholic health care. That's good because there aren't any Catholics up here. Okay, and she's.
I didn't out myself. I'm sorry. I'm a proud product of Archbishop Hunhausen.
Oh my gosh! So maybe we should switch seats because she's Jewish and I'm Episcopalian.
There's the irony.
So look, I don't really think this is about Catholicism, and to tell you the truth, I don't even think it's about hospitals. What I think this is about, I think this is about collaboration. Because I'll just tell you, if you know anything about healthcare, it isn't the Catholics or the Jews or the Episcopalians or the hospitals or the doctors or the mental health clinics. Not one of those can provide the health care that this community needs. That can only be done by all of them working in collaboration. And I think that's the real key discussion today. And quite frankly, there couldn't be a better place in America, with the possible exception of Rochester, Minnesota, where, by the way, the Mayo Clinic also partners with a Catholic hospital. But there couldn't, I hope you realize what you have here in Bellingham. You are one of the model communities for health care in the whole country. So this is a great place to have this conversation.
So I want to just clear up a couple of things that you prompted, Sarah. So as to the reproductive issues, the one thing that we don't do is elective abortions. But as I said earlier, elective abortions are generally not done in hospitals. That's not a good use of healthcare resources. It's the wrong environment. If there's a fallopian, if there's an ectopic pregnancy, we do administer methotrexate, and if that doesn't work, we do remove the fallopian tube.
Can I interrupt you for a
Please.
minute? So I want to make sure you guys got this, because what I get concerned about is you hear stories about what was
Very
it,
scary
Nebraska or
stories.
someplace like that?
Well, it's great that PeaceHealth follows this, but there's other Catholic healthcare corporations in Washington State. That's why I appreciated, Nancy, you clarifying. I think it's helpful for people to know what PeaceHealth does and what the other corporations do or do not do.
And Stu, when was it that the state was 100%, or the healthcare was 100% Catholic? I mean,
So one of the things that's kind of funny about this, and I'm going to explain this to you when I talk about the Constitution, but the Washington State Supreme Court has noted in its opinions that when the Constitution for this state was written, and when they put in that exception that said, well, you can't use public money to give to private entities except for health care, at that time, the court has noted that all of the hospitals in Washington State were religiously operated, okay?
so we've actually gone backwards on that. But anyway, back to some of the facts on women's reproductive health. So it isn't a euphemism that the relationship between a patient and their doctor is a private relationship, and that we don't either condemn or condone. Those are conversations between a patient and their physician. And so I can tell you that birth control is administered and prescribed, and the requirement for documentation for medical necessity is not audited, and as I said, it's neither condemned nor condoned. It is performed. If there is a problem with the baby or the mother, the baby is taken. So that is not universal, you're quite right, but I can only speak for PeaceHealth.
Hey, Nancy.
Yeah?
So you talked about ectopic pregnancy, and I want to make very clear people understand that PeaceHealth does use that drug. By the way, it's called methotrexate, okay? And so PeaceHealth doesn't do what the story in Nebraska was about, right?
Nope. No,
Okay.
definitely doesn't.
Well, now, Nancy,
Yeah?
how about artificial hydration and nutrition?
Yeah.
Does PeaceHealth refuse to disconnect people when their relatives ask for that if they have a power of attorney?
Yeah, no, absolutely not. Not only do we follow a patient's wishes, we actively promote advance directives and have been doing classes in this community and more recently in the San Juan community trying to educate people about how to complete a durable power of attorney and an advance directive. But it's not enough to complete an advance directive. You have to give it to your doctor. So we do a lot of work to try and make sure that people have that available to them. And so we support end-of-life wishes and, again, actively teach people about how to participate in that. And we always follow the wishes of the patient, including ending hydration and life support and other means of artificial support.
Now, Nancy, how about this concern?
Wait, we didn't plan this. I don't know what you're doing here.
How about this deal that health care at PeaceHealth is dictated by religious doctrine and not by the best interest of the patient in accordance with the standards of care that are dictated by the medical profession itself?
Right, no, medical care is always under, is controlled by the physicians in our community. But, the bishops do have impact on the services that are provided. And, we were asked to evaluate our services to Planned Parenthood through lab services, Linda knows. And we talked about what was possible. And even though there were alternatives to PeaceHealth, Planned Parenthood didn't like it. And so we basically said, okay, good enough. We never threatened to stop services, and we never stopped services. And so there's been a lot of misinformation about that, and I want to clear that up. Even though the bishop did ask us, we never did stop lab services.
Let me just highlight this for a minute. So I'm an attorney, right? And my job is, we do get medical malpractice cases sometimes. Can you imagine how many medical malpractice cases we would get if we didn't follow what is good medicine? In fact, we do follow that. And if you check, what you'll find is PeaceHealth has far fewer medical malpractice cases than most. In fact, every year at the end of the year, we get money returned from our insurance trust because we have so few.
Thank you both. I appreciate your perspective. I know we want to get to questions. I have a few questions from the committee. We all acknowledge the fine health care that we get in this community from PeaceHealth. This issue is not about the fine health care we get, but the health care that we might not receive because of the ethical religious directives. One of the questions I'd like to ask is, I had a friend who had a surgery procedure at the surgery center from a PeaceHealth a doctor, and she was asked to sign a waiver to her advance directive. Is this a common thing that happens?
I couldn't speak to that. I don't know anything about it. I mean, it's hard to do hearsay. Was she in the Pacific Rim outpatient surgery or in our main OR or?
Not in the Pacific Rim.
It was probably
But it was a PeaceHealth practice. A doctor in a PeaceHealth practice was my understanding.
I'd have to have more facts to be able to reply to that. But
well, would you say that that's not something that usually happens?
Well, I want to emphasize one thing. So what's being discussed here is an ambulatory surgical center that is not owned by PeaceHealth, not controlled by PeaceHealth, and those are not PeaceHealth policies. So, I can't tell you what the Pacific Rim Surgery Center requires or not, but that's not PeaceHealth, and I can guarantee you that's not a Catholic, run operation.
Perhaps you could discuss with us, a lot of conversation has been going on about the possible merger or strategic alliance, I think it's called now, with the University of Washington. That is, as someone has mentioned, our main training hospital for doctors. And we'd like to know how that might, alliance with them might affect the training on things like transgender issues, birth control, pregnancies, all the reproductive and death with dignity and all those kind of things that the doctors are being trained in now at that facility.
So look, Senator Ranker, on Orcas Island, wrote a letter to the University of Washington and asked this very question. And I just read the letter, so I'll tell you what the University of Washington said. And the answer is, it won't change one iota, okay? And I just want to say to you, this deal with the UW, this is a red herring. You know what our agreement with the University of Washington said? We want to arrange with you, when we have patients who are extremely sick and need care that we can't give, we want to have prior arrangements with you so we can transfer them to the University of Washington, and their records, their electronic records, will already be there waiting for them. So this was a transfer arrangement. And then in addition to that, we said, hey, look, if you guys are training docs out there, we'd love to have some come to Bellingham and be trained. And you know, think about it. I mean, we're not entirely altruistic about this. There's a shortage of docs. And it's great to get these young people up to Bellingham. Yeah, maybe we'll take them out to the lake or up to the mountain or out on the water, right? Why? Because we want them to come back here and practice medicine for you guys.
Sarah, would you like to address that too?
Hello? Okay, now that's better. I'm going to give a slightly different version. So the University of Washington and PeaceHealth completed what's called a letter of intent, and that means it's a form of a transaction where they've agreed to sit down and discuss and decide whether they can reach agreements that hopefully they'll do by September 30th, which will spell out a couple of things. One, first and foremost, is the University of Washington is renowned for its complex tertiary care, burn patients, Heart Reviews Trauma Center. So in part, what this should hopefully do is create a formal arrangement where PeaceHealth patients are sent to the University of Washington. The details of that agreement have yet to be worked out. What we as patients and consumers should be asking is, once the patient leaves the PeaceHealth facility and they are in the UW facility, will they be governed by UW medical care, or will the UW physicians have to abide by the PeaceHealth Statement of Common Values, which is available on their website?
So, but Sarah, the U answered this, and
Well, let me finish.
Okay.
I get to finish. So these agreements, so this is, again, questions you guys should be asking. These agreements have not been yet formalized. So I think everybody in this room wants PeaceHealth patients to go to the UW. Nobody disagrees with that. The question is, when a UW physician comes out, an oncologist, who knows what's going to end up happening with this deal in terms of, let's say a UW oncologist who has a specialty in a particular cancer may visit a PeaceHealth facility to work with a patient. Once that UW physician enters PeaceHealth property and facilities, who are they governed by? I can tell you, for example, because we've gotten this through a public records request, for the San Juan Island Medical Center, there are doctors out there who are using the San Juan facilities. They are not doctors of PeaceHealth. In their lease agreement, they're required to abide by the Statement of Common Values. They're not allowed to do certain procedures. So that's a question people should have as these details are worked out. Second question people should have. Part of the letter intent was the UW and PeaceHealth wanted to explore conversations about whether the UW wanted to send students, and I suspect students already rotate through PeaceHealth hospitals, but residency. What we want to focus in on residency. We have an amazing family care and especially a rural program, and I think there's interest in actually Southwest Washington and Clark County. So the question, again, is if you're sending UW residents and partnering with PeaceHealth, what are the details of that partnership? And how will these UW students, not students, they're medical doctors at that point. What will be the requirements on their residency? Will they be governed by the University of Washington, which is not constrained by the Statement of Common Values, which is PeaceHealth's version of the ethical and religious directives? Or will they have to be constrained because they are providing medical services within a PeaceHealth facility? That's the questions to be asked.
So Sarah's giving us all some homework. And now I'm going to open this up to the audience. We have two microphones. One here is Chuck, and Dawn has one on the other side of the room. Because we have so many, we're going to start with people who have badges and belong to City Club. And I think Chuck has a question over here to start with.
I'd like to thank all the panelists for coming today, but it seems to me that you're talking past each other. That Sarah has raised a number of questions. Nancy and Stu have done a great job of saying what PeaceHealth doesn't do. But the issue that I find interesting is the theoretical issue, the conflict between, call them what you will, statement of common values, or the ethical and the ERD, religious directives. When they conflict with medical science, then where should our healthcare system, be it controlled by a religious institution or not, come down? And how do we as a group attempt to resolve those problems?
Well, I think that's really a great question, and I think that's one of the values of bringing us together today is to have the conversation. Remember, the sisters came here to listen to the needs of the community, and I think we want to listen and entertain dialogue, a mutual dialogue, to find how we can collaborate together to meet the needs of the community. I think that's really what we all want. And it doesn't mean that there's black and white here. There are things that we don't do today, like kidney transplant, and we don't not do them because of ethical and religious reasons. It doesn't make sense. Why would we try and duplicate services if they're already provided in the community? But I think the point is, how do we work together to meet the needs of the community, to make sure that the needs are handled in the community so people don't have to leave? I would tell you of note, 87% of the people who live in this community get care at St. Joseph Medical Center and in our clinics today. The question is, how do we make it even better so people don't want to leave? Clearly, they will have to leave for things that we don't do, like kidney transplants, but how do we make it so that the services that we collaborate with the rest of the community, be they WAHA or Interfaith or Planned Parenthood or CMAR or Family Care Network, how do we collaborate to meet the needs of the community in the best and most cost-effective, highest quality way?
We're
I think
going to
that's
let
what we want to
Sarah
do.
address this too.
Okay, so just 2 quick points to make. And again, these are questions that the group should be raising. First, PeaceHealth in April announced they had been engaging in negotiations for the last 5 years with Catholic Health Initiatives, which is based in Denver. Catholic Health Initiatives is a strict adherent to the ERDs. So the questions that you as a community want to be raising is, right now you have a good status quo, I think, for some residents. So the question is, how do you maintain that? Given that a year from now or 4 years from now, there may be a completion of a merger with an even more restrictive Catholic entity. And then 2, I want to draw your attention back to PeaceHealth's Statement of Common Values. On page 2, they have a section on medical research. And in that, they talk about, for their organization, they will not allow therapies that relied on stem cell research that involved the destruction of embryos. So this is the question we have for each other. If a year from now or 3 years from now we find a cure for Parkinson's, it was done through stem cell research, but during the course of that stem cell research, there were embryos destroyed. Does that mean that PeaceHealth patients will not have access to those therapies? They do say in their Statement of Common Values that if the stem cell research does not involve the destruction of embryos, that they welcome that research. And of course, they want that to be done. But again, questions for you to be turning around and asking your medical providers.
Over here.
Excuse me, before we start, there's a gold Toyota Sienna that's blocking a car that needs to leave. So the next person who gets up should be embarrassed.
I'm getting up and I'm not embarrassed.
Okay.
Hey, can I ask if you think you got a straight answer to your question? Because I want to make sure you did. I don't think you did either. Can you say the question real tersely one more time? And I promise to do my best.
The question, as straightforwardly as I can make it, is, I know what PeaceHealth has said they're doing, that's fine. I know what the questions that Sarah is raising, that's fine. But the issue I thought we were coming to hear about was what should we do, and what is the situation where religious beliefs and directives, if you will, ERDs for choice, conflict with the availability of other therapies and other ways to treat disease.
So let me answer this. There's what's called a standard of care. Maybe some of you are familiar with this, and it's required by law. If a physician or a hospital fails to abide by the standard of care, and these are often defined by specialty organizations, they're subject to medical malpractice. That's number one. And number two, hospitals have to be accredited and licensed. And so maybe if you're business people, you know that you have auditors come into your business and check your books. Well, hospitals have top to bottom auditors come in, unannounced by the way, to check and make sure they're abiding by the standard of care. And so the short answer is, if any hospital fails to abide by the standard of care, regardless what their reason for doing it is, they would lose their license and be subject to lawsuit. So that always trumps. That always trumps. And that's precisely why we don't get in between the patient and the physician. The patient tells the doctor, and then the physician makes recommendations, and the patient makes the decision.
Sarah.
So I'll just respond briefly. I think Mr. Hennessy is right that medical care is governed by a standard of care. Then within that standard of care, there's going to be different options that the doctors can do. There are always going to be multiple procedures that a doctor can do in a certain situation. I hate to keep coming back to this, but ectopical pregnancy, great example. If it was medical malpractice for them to take the fallopian tube without also offering you the drug, there would be tons of lawsuits. What you have in that situation is a Catholic doctor saying, I'm so sorry, I can't perform, there's two different ways to solve this problem. I can perform one of them, I can't perform the other. Wonderfully, PeaceHealth apparently, right now, currently today, offers both those procedures. So your question is, in future and today, what do I do if I'm in a situation where they don't offer that other procedure? Or in future, what about the concerns about we're looking forward to advances in medical research. That's the point. We can't predict right now the advances in medical research. I hope that was somewhat helpful.
Over here.
Yeah, I have a question regarding the rationale for the extensive number of takeovers, buyouts, whatever one wants to call it, that have happened locally. A number of years ago, there was a major radiology practice that was taken over by the hospital, Madrona. There's been cardiology practice and others. I've heard it asserted that there are two rationales for that, strictly economic. One is that when a private practice is taken over by a nonprofit, nothing to do with religious, but a nonprofit, all of a sudden there is a significant reduction in operating costs because of the elimination of tax revenues that have to be paid. The other assertion, economic assertion I've heard, was that insurance reimbursements for procedure X performed by a private practice versus procedure X performed by an organization owned by a hospital is the reimbursement, the insurance reimbursement is a multiple of what it would have been in the private practice. Both of those seem to have a major impact on the economy of both the local as well as national. It affects all of our insurance rates because higher cost is being paid for the same procedure.
And your question?
My question is, how do you folks justify that on an ethical basis?
So I'll start, and then they can. Yeah, I'll start. So there was a New York Times article in the last month or so raising the exact point that this gentleman just raised. That right now, if you go to a doctor's visit in a physician's office, he or she can be reimbursed. I'm going to pick a number for $24. It's in the New York Times article what the exact number is. That same visit by the same type of doctor, if it's performed in a hospital, they can seek reimbursement of like $98. So the New York Times and others are raising the point, and actually this is being discussed right now by the federal government because they're looking at Medicare and Medicaid reimbursements, that created perverse economic incentives, that these healthcare corporations who operate hospitals were going out to buying up the independent physician groups because frankly they could make more money if these visits were under a hospital rather than a physician's group. So that is a question that I think is being hotly debated across the country right now. I want to get back to his original question, which is why do we have all these transactions? you know, as I said, I think there is a lot of consolidation that's happening because of healthcare reform, which is great. I will let you know that Catholic Health Initiatives, in a document that they submitted to the government, acknowledged that as far back as 1995, their vision of healthcare, they saw healthcare as an important part of the Catholic religion, that was important to Catholics to participate in the United States healthcare industry. And it was their vision that they saw the continuum of care. And this is all laid out in a document that I'm happy to share with people, where they talk about wanting to buy the hospitals, the pharmacies, the laboratories. You know, we can debate about what was the motivation. All we can talk about now is the practical implication, which it is a smart move, whether or not it was intended, but they have circumvented the political process. Victories they could not get in Olympia, they're now able to get because they own the facilities. They get to decide which procedures do and do not get to be performed. So that's a non-economic answer, but I think it is hotly debated whether it's economics that's driving things or religious motivation, and I don't know that we'll ever know the answer to that.
I'll try. First of all, let me clarify, we don't own the radiologist. We have a joint venture with Northwest Radiology, and that's called Mount Baker Imaging. That was done before I got here, and I have to say it's one of the best joint ventures I have ever seen in my career. They are better at running the business than we are, and by being together, we have not had to duplicate technology, millions of dollars of equipment. If we were separate, they'd buy one, we'd buy one, we'd compete for staff. It is a fantastic joint venture, and I think the community is well served by Northwest Radiology and Mount Baker Imaging, which is a partnership with PeaceHealth. Madrona Medical Group approached me 6 weeks after I came to Bellingham, asking to be acquired because they were not financially stable and could not afford the medical records that they need that were discussed earlier, and sought PeaceHealth as a partner to help them sustain themselves within our community. And North Cascade Cardiology also approached PeaceHealth to be acquired for some of the very same reasons. The vision that was put together by Dr. Roland Trenuth and Don McAfee years ago had gotten to a point where the integration with the hospital was really important for us to continue to meet the needs of the community. So in every case, the organizations approached us, PeaceHealth. We did not seek them. Again, as I told you earlier, we only go where we are invited. As to the tax issues, Madrona and North Cascade did pay taxes before they became part of PeaceHealth, and they no longer pay taxes because they're part of a nonprofit, and there are a lot of opinions about that. But my answer to that is that by becoming part of PeaceHealth, we take care of all patients regardless of ability to pay. And the amount of bad debt and charity care that we have in both Madrona and North Cascade far exceed any dollars that you would pay in tax dollars. And so this has really offered much greater access to health care, especially to those folks who don't necessarily have access to quality health care. In terms of growth and consolidation, I came here 6 years ago from California, and I was shocked at how unconsolidated Washington State was. California has been much more consolidated for many years, and it's because the cost of health care has been so great that it was a greater pressure in California than it's been in Washington. But in the last few years, you've seen more and more consolidation with Providence Swedish and with many other organizations and hospitals acquiring medical groups. The lab's been part of PeaceHealth for more than 6 years. So the idea of this, though, the bigger you are, the more you can leverage what I call skill and scale. So organizations like San Juan Island, were they on their own, they'd have to have a CEO, a CFO, an HR executive, and so on and so forth. Because they're part of PeaceHealth, we can provide services from Bellingham to San Juan that they could never attract or afford. And so by being a bigger organization, we can leverage the talent that we have at St. Joseph Medical Center across larger organizations. And then finally, to the cost of hospital-owned practices, yes, it's true that they do cost more. Part of the reason is that we have different standards. As both Sarah and Stu were talking about, healthcare is extremely regulated, and when you function under a hospital license, you are held to a higher standard. So where you might have a medical assistant or an LVN in a hospital practice, you have to have a registered nurse. In medications, you're not required to have medication reconciliation on admission and discharge. If you're run by a hospital, you are required to have higher standards. So yes, naturally, there there is a higher cost if you're seen in a hospital-run organization for ambulatory care. And I would be the first to say healthcare finance is messed up. I think that New York Times and the Time magazine article were outstanding, well documented, and I think we have to fix those problems. I in no way mean to defend them at all, but it is the system that we're working in. So I would be the first to want to work to improve healthcare financing.
Yeah, I
Excuse
just
me,
want
Stu, I think Nancy answered that question quite well, and so I think we'll move on because you two were supposed to share. Chuck,
we've
do you have a
never been
question
very
back
good
there?
at
Yes. Thank you all so much again for being here for this intense and lively discussion. So what I was getting a little bit from what Sarah was saying is that there are these ethical and religious directives, and that PeaceHealth has had the ability to sort of interpret them a little more freely and offer some services that perhaps other Catholic systems don't. My question is, should the Archbishop decide to put his foot down and demand that you stop offering the services that you have chosen to do, what would happen then?
Well, again, we've had different bishops have different perspectives. The previous bishop actually had no issue with it at all. And I think the bishop has asked us to stop, and we have respectfully declined.
And can I add to that? So I have a vision that I'm just going to state it with Ms. Steiger and Mr. Hennessy here. There's some interesting things afoot with the Catholic healthcare corporations that were founded by the nuns as opposed to priests. And there's, sorry, I mean, I love nuns and priests being.
It's a little bit boy girl.
And what's interesting is that there's a corporation down in California that was founded by the nuns, and they are moving to try to change their corporate structure, and they are disengaging from the Catholic Church. They're not all the way there yet, certainly, but they are moving in that direction. And so I would encourage consumers and residents of our state that if we so desire to sort of push these religious healthcare corporations to start decoupling from the Catholic Church, I think that can be a very realistic possibility.
As you can see, we're close to our closing time, but both our panelists were very nice in saying that they would stay for like 10 extra minutes because we knew we'd get a lot of questions. So we're going to continue for another 10 minutes. And Dawn, you have someone over here?
Hypothetical. I'm fatally ill, 3 months to live, and want to end my life with dignity. I go to my PeaceHealth doctor, and he prescribed me pills on your premises, and if not, can he prescribe me pills off of your premises?
This is a theoretical question or a real question or what? Yeah, okay, sorry. So prescribing the death with dignity medication that is approved by the state is not sanctioned within PeaceHealth Medical Group, but physicians have their own time, and what they do on their own time is up to them. Again, PeaceHealth does not condemn or condone. It's between the patient and physician relationship. I can tell you in our hospice house, we have had patients take the lethal medication. I don't know who prescribed it. I don't know how they got it. I know they got it, and I know that we didn't abandon them, and that is our policy, that we will never abandon patients. Patients have been taking their own lives long before it was legal, and we will never abandon a patient at the beginning or end of life.
Let me just tell you that, you know, in the PeaceHealth standard employment contract with our doctors, and you might be aware, PeaceHealth provides care in some of the most liberal communities on the left coast, okay? I mean, we're in Eugene, Oregon, where there's people are still all, you know, they're all deadheads down there, right? And so when we had this concern by docs when we first started the group. And so what we did is this. It's not very complicated. It says you're supposed to work exclusively for PeaceHealth, except you get 16 hours a month. You do what you want, okay? I mean, how hard is that?
You know, I would encourage PeaceHealth. On United General, there's a great frequently asked questions, and they talk specifically about death with dignity. I think that would help the community to hear information like that, because right now it does say PeaceHealth does not participate in death with dignity, and moreover, PeaceHealth will not give a direct referral. They will only refer to an agency, in this case the Department of Health, for someone to capture information about death with dignity. So I think it's very heartening to hear the CEO and the General Counsel express these sentiments to you all, and I hope that it gets put down in writing somewhere.
Yeah, so that's actually not accurate. We don't report to the, refer to the Department of Health. We refer to the Medical Association, and many of which our doctors are all members.
So again, it would be great for that information to be updated on the United General website.
Chuck, did I see you over there with a question? No. No? All right, here we go.
Yes, we do.
Well, I am just curious, what exactly is your relationship to the bishops? And is there money that goes that way to support them? Or why, in fact, can they say anything to you other than the fact that you're Catholic?
So thank you. Because there's a lot of misunderstanding about this, and in one of the articles it referenced, well, that it suggested that we get money from the Catholic Church. Listen, if you guys ever get any money out of the Catholic Church, let me know right away, will you? Because we don't get a penny, okay? So that's number one. Number two, if you go to most Catholic health systems, you will find that their property is what's called ecclesiastical property. That means church property. But in the whole world, there's one that it's not church property. PeaceHealth. It's the only one in the whole world. So we get to say, yeah, we do what's called apostolic work. The church believes that caring for the sick is something that Jesus did and that the apostles carried on. And so they say, yeah, because you care for the sick and you care for people regardless of whether they can pay, that's apostolic work. But we get no money from them. We don't send them any money. And our property, they have said in writing, and I'd love to show you these documents because they're covered with red wax and seals. But they have said in writing from the Vatican, it's our property. It's not their property.
So I think Mr. Hennessy has just done a great job of my point earlier about I think it's encouraging that PeaceHealth has the ability to decouple even easier than I expected, right? I mean, so I think the ACLU has a vision that all Washington residents would be able to receive medical care that they're entitled to under the law. And to the extent that PeaceHealth isn't currently offering procedures and services that residents are entitled to under the law because of Catholic doctrine, we've just heard some great information and evidence as to why it should be relatively easy for them to eliminate those practices from their corporation. And we would encourage them to do so.
The mics are open for everyone now. Anybody got a question? I saw one over here.
Go ahead.
I said to everyone.
I have a question. Nancy, earlier you had said that you respect the privacy of the doctor-patient relationship. I spent a lot of time on San Juan Island, and I'm curious as to how anyone knows what the physicians at Inter Island Medical Clinic did or didn't do prior to the arrangement with PeaceHealth. Because my argument to you would be that, as far as I know, there was no policy against death with dignity or against abortions. And in fact, I believe your information is inaccurate. And I think it's really important that if you're going to say that you respect the sanctity of the doctor-patient relationship, that there shouldn't be any way that you know what happened between doctors and patients previously.
I only know by discussions with the physicians, and the physicians all there have told me they did not participate in abortions or euthanasia before. I have no access to medical records or anything of that sort, if that's what you're implying. But I can tell you, to a doctor, they have all said they did not participate in abortions or euthanasia prior to participation with PeaceHealth. And when we talked to them about that, it was no issue for them because they weren't stopping doing anything they already had been doing.
Okay,
Sarah?
I'm going to give a slightly different factual version. This doctor doesn't know I'm doing this, but because I'm making this public, I'm presuming he's not going to get fired, terminated, or they're not going to end his lease. So I think what Ms. Harrington is referring to is there was a doctor who would visit San Juan Island, the clinic, once a month and provide OBGYN services. Dr. Prin, he is affiliated with Island Hospital. He would not, I don't think he performed abortions on the island, but he was certainly providing counsel to the San Juan Island residents, and then they would go to Island Hospital and his clinic for further procedures. When PeaceHealth opened up the hospital in November, he was no longer on the island providing services. The community was upset by that, and if you go and now look, Dr. Prin is back on the island within the PeaceHealth facility providing OBGYN care. Within the lease, and this is why we were investigating this is why I know about the lease. Technically in his lease, he's not supposed to be providing information about abortions or participating in them. So we're trying to get more information because what we hope is that services have been restored and that he is back doing exactly what he did prior to Peace Island Medical Center being opened in November 2012.
I'm not a member. I am a cradle Catholic who is here because I'm petrified about the ongoing negotiations between PeaceHealth and Catholic Health Initiatives. I mean, you are liberal compared to them. And I shudder to think what would happen to our community. What would happen to our community if that merger took place?
Don't lose any sleep. That deal's dead. And you know one of the reasons why? Because as we got into further discussions with them, it became clear to us that they thought they were going to be in control. And if you know anything about the Sisters of St. Joseph of Peace, that wasn't going to work.
We have a question over
Mr.
here.
Hennessy, you spoke to the value of collaboration. That's a hard thing to argue with. Can you please give some concrete examples of how PeaceHealth has made an effort to collaborate with Planned Parenthood?
Oh, wow. Thank you for that question. You know, we have both been in this community for a long time, and Planned Parenthood does essential work. They care for the most vulnerable in our community. 97%, I think that is right, Linda, have nothing to do with fertility or pregnancy or anything like that. They provide primary care to some of the most vulnerable. And that is God's work, that is mission work, that is our work, and we absolutely support that. And we very much respect everything that they do around fertility and women's reproductive services, so much so that we have been providing lab services for that. How long, Linda? 20 years. I mean, it's a long time we've been providing lab services. And when, under the direction of the bishop to stop such services, we had a conversation about what we could do. Could we give them the equipment? Could they work directly with the pathologist? Could we teach them how to do the tests? And all of these were viable possibilities. Planned Parenthood did not think that was a good idea for, I think, a very good reason. Felt it might be a slippery slope. And how would that really work? And they basically said, look, PeaceHealth, we have been partners for a long time. We really would request that you continue providing services that you have provided for years. And we said, fair enough. And that's the end of the story.
I also just want to give some credit to Linda McCarthy and the board of Mount Baker Planned Parenthood. They, I believe, are the only Planned Parenthood in the country, the first, to say no to the Catholic Church. CHI purchased the labs over in Spokane back in 2009. Shortly thereafter, in 2010, the Archbishop for that diocese asked the labs to stop running Planned Parenthood labs, which they did. And so I just did want to give credit to Linda McCarthy and Mount Baker Planned Parenthood because they have done what no one else in the country did, and it ended with a successful result. that PeaceHealth did not agree with the bishop, and that is fantastic. And we thank PeaceHealth for that.
I appreciate that. Thank you.
Hey, look, with all due respect, I'm up here with two women, and the guy asked the question to me, and I never got a word in edgewise here.
I think he got a lot of words in edgewise, didn't you?
Maybe you and I should talk afterwards.
Okay. I think, we're coming to the end because I know Nancy has another commitment she said she had to get to. So I think this was a good beginning discussion today. There are a lot of issues we didn't get to, but I think we'll probably try again. And I really want to thank all of our participants because I think they were very helpful. Let's give them a good hand. We have a small gift, our book, to our participants, a little bit of thank you for giving up your time. And thank you all for coming, and we'll see you in July for Hedrick Smith. Thank you.
Jane, can I make one final comment? There was just an article printed in Modern Healthcare, and it says that hospital performance differs by ownership, and the performance in Catholic hospitals is better than any other. Thank you.